Okay, so today we're cracking the code on what physicians are really talking about when it comes to stroke. We're going to translate their biggest challenges, their private conversations, directly into your next big opportunity. Let's dive in.
And we're not talking about a small focus group here. This whole analysis is built on a massive foundation, over 17,000 distinct physician discussions. The scale here is just huge, and it gives us this incredibly authentic look into what's happening on the ground.
So, where's all this data coming from? It's from GMED, which is the world's largest closed network for physicians. This means these are completely candid, unfiltered conversations happening between colleagues, behind closed doors. This is the real deal. So for anyone trying to reach and support physicians, this is the million-dollar question, right? What are they actually thinking? What if you could just be a fly on the wall? Well, today, you can. Think of this as your new secret weapon, your new intelligence report. All right, let's start with the big picture. When doctors from over 76 countries talk about stroke, what are the topics that just keep coming up again and again? So before I show you the full breakdown, just take a guess. What do you think it is? Is it some, cutting-edge new treatment? A fancy diagnostic tool? Nope. Turns out, the #1 topic is something much more fundamental. That's right, risk and prevention. Almost a third of all conversations are about this. It's not just some side topic. It is the single biggest thing weighing on physicians' minds. Now, looking at the full picture here is really telling. You see how prevention just towers over everything else? But right behind it, you've got post-stroke monitoring and the practical side of using anticoagulants. This tells you doctors are thinking about the entire patient journey, from way before a stroke might happen to long, long after. And if we dig just a little deeper into that #1 concern, prevention, a huge pain point just jumps out. A staggering 71% of doctors voiced real concern about uncontrolled blood pressure in their patients. This is clearly a massive area of frustration for them.
Okay, now let's go a layer deeper. We're moving from what they're talking about to why. We're going to pinpoint the exact clinical dilemmas where physicians are looking for answers. And for any marketer, these are the moments where your support can make all the difference.
First up, it's a classic, the diagnostic dilemma. Picture this, a potential stroke patient comes into the ER. The doctor has a choice to make, and it's a big one. Do you go with the CT scan, which is super fast and available everywhere, or the MRI, which is way more precise but also slower? It's this constant battle between speed and certainty.
And this chart just lays it out perfectly. More than 3/4 of physicians love the CT scan for its speed, because in stroke care, time is brain, right? But look at that other slice. Almost 1/4 of them are really worried about its limitations, that it might miss something critical.
Now on the flip side, you have the MRI. It's hailed as the gold standard for getting it right, with 88% positive sentiment. They trust it. But the problem? That 12% represents the real-world frustration with delays and just not being able to get access to one quickly. It's this constant tug of war between what's ideal and what's actually possible. But, diagnostics are really just the beginning of the story. What happens when it's actually time to treat the patient? Well, the sentiment here reveals one of the most significant and frankly surprising insights in this whole report. Just look at this. Nearly 3 out of 4 physicians express negative sentiment when they're discussing acute stroke treatments. They're worried about bleeding risks, treatment delays, and how few patients are even eligible. So even with the tools they have, there's a huge unmet need and a ton of anxiety around actually intervening. And these debates don't stop. Take statins, right? A cornerstone of prevention. Well, the physician community is almost perfectly split down the middle. Half are worried about side effects and tolerance, while the other half are all about the prevention benefits. This is a community divided, and they are searching for some clarity. Now, if you think that's complex, let's add another layer, because these conversations, they don't happen in a bubble. They change dramatically depending on where in the world a doctor is practicing. A one-size-fits-all strategy? It's pretty much guaranteed to fail. And to see what I mean, let's just go back to that statin debate. In the UK, physicians show really high confidence in them. But you hop across the channel to France, and suddenly the conversation is all about high concern over side effects. 2 countries, right next to each other, with 2 totally different mindsets. And this heat map really paints the bigger picture. Just look at the patterns. In the US and Canada, doctors seem to feel they have broad treatment access. But in the UK and France, they're talking about limitations. Statin confidence is high in the UK and Canada, but concerns are the main topic in Germany, France, and Brazil. Every single market has its own unique mix of beliefs and barriers. Okay, so we've seen the what, the why, and the where. Now, for the most important part, what do you actually do with all this? This last section is all about turning these physician conversations directly into real strategic opportunities. Here it is. This is your playbook. First, address those knowledge gaps we saw around things like anticoagulants. Second, help streamline protocols. Provide clear, simple education on that whole CT versus MRI dilemma. And third, help them support adherence with tools for that crucial post-stroke follow-up period, which we know is another area of concern.
And that really brings us to the final critical question. After seeing all this data, the raw, unfiltered conversations from the front lines, you have to ask yourself, is my strategy really aligned with what physicians are actually talking about, worrying about, and debating day in and day out? Because the answer to that question, well, that could change everything.